Your computer is perfectly fine.
There you go. Yes, got it.
Wonderful. Okay. All right. Thank you for attending our webinar, An Introduction to Livestock Depopulation. Before we begin, we would like to acknowledge that the land our farms exist on and the land we call Alberta is the traditional and ancestral territory of many peoples, subject to Treaty 6, 7, and 8, namely Blackfoot Confederacy, Chinai, Piikani, and the Siksika, the Cree, Dene, Saulteaux, Nakota Sioux, Stoney Nakoda, and the Tayutina Nation, and the Métis people of Alberta. This includes the Métis settlements and the 6 regions of the Métis Nation of Alberta within the historical Northwest Métis homeland. We acknowledge the many First Nations, Métis, and Inuit who have lived and cared for these lands for generations before us. And we are grateful for the traditional knowledge keepers and elders who are still with us today and those who have gone before us. We would not be here without them. We make this acknowledgement as an act of reconciliation and gratitude to those whose territory we reside, farm, and live on. While recognizing the historical impacts of settlement on these lands, we wish to express our common goal to care for our water and natural resources for all future generations to share in.
Thanks, Rebecca. If I can get the slides to advance now. My computer's working overtime with all this stuff going on it. So AgKnow is an initiative that we're working on here in Alberta, and it's the Alberta's approach to farm mental health. So you've probably seen a few of these farm mental health approaches happening across Canada. This is Alberta's version of that. So our mission is to promote the mental health and resilience among farmers and farm families so that they can lead productive and fulfilling lives. So we do more than just talk about the problems. We want to be part of the solutions. And so we're a full circle, you know, like we do the research all the way to impact, and we're constantly engaging with the farming audience. So we're working to identify the key issues, stressors, and needs of our Alberta farmers, and to actively engage in the mental health and healthcare providers to address them. So this webinar is one of the few that we have planned over the next year that will explore some of the topics that we've identified in our white paper and that have come out through the research that's ongoing right now. So our intention is to increase the capacity of mental health and healthcare professionals to provide the care and support to Alberta farmers. And this comes out of some research that was done nationally that showed that a barrier to seeking help for farmers was the idea that they aren't well understood and that their needs are not understood by healthcare and mental health providers. So that's kind of the issue that we're trying to address through the professional development activities that we do here at AgKnow. So I want to introduce you to the AgKnow team. I'm Linda Hunt. I'm a program director and I work closely with the agriculture side of the business. I'm a forage and livestock agrologist and farmer with over 20 years experience working with farmers on production and research, extension, and policy. Dr. Rebecca Perk-Stephenson is joining me today, and she is a university professor working out of the University of Alberta's Augustana campus in Camrose, and is closely connected to other researchers in this field, including those at the University of Guelph that led the national survey that we're talking about, that gets quoted the most, I guess. She's also a part of the National Strategy for Farm Health and Wellness and is well connected in the healthcare community. So we're also joined by Dr. Dolores Peters, who is a veterinarian and the manager of the Animal Health Unit for the Ministry of Agriculture and Irrigation here in Alberta. And while we have different specialities, our common thread is that we all have experience in agriculture and farming. So with that, I'm going to let Dolores take over her part of the presentation. And she has said that if there's any words or any terms that she's using in her presentation that you don't understand, please tell us about them right away. And otherwise, there'll be hopefully some time for questions at the end of the presentation today. Go ahead, Dolores.
Welcome. So thank you, Linda. I am a regulatory vet for the government of Alberta, which means that I am often the deliverer of bad news to a producer. And I'm thrilled to be talking to you today so that you can understand what farmers and vets go through, because I'm not the greatest one having just delivered the bad news, to be helping farmers through the stress and the distress of what's happening on their farm. I'm going to talk about what depopulation means, when it's used, what happens to a farm during disease control, and what happens to related farms and to the community in general. Next slide, please. So depopulation is when we kill all the animals that are connected to the disease. It may mean all the birds on a farm. It may just be those that are of the same age group as the elk that was positive for CWD, chronic wasting disease, but it is a disease control method. We use it in two cases. One is severe animal disease, where the disease-causing agent is devastating to the animals and would be devastating if it spread from that farm to all the other animals. So examples of that, many of you are familiar with avian influenza, which hit us hard last summer. In poultry, foot and mouth disease is a disease that causes severe production losses, loss of weight of gain, loss of body condition, loss of milk production in cattle, sheep, and pigs. African swine fever is a disease that's never been in Canada before, but it will cause devastating losses in pigs. Chronic wasting disease is like mad cow, but it's specific to elk, deer, and moose. And because some of these have very poor tests, like chronic wasting disease does not have a live animal test, because we have no good control methods. The vaccines aren't very effective. We have no treatments for the disease. Sometimes we have no good we have no good test for them. We're left with depopulation as a disease control method. It certainly isn't anybody's method of choice. The other reason we depopulate is food safety. So these three diseases that are listed here, Salmonella enteritidis can infect the ovary of hens and then be transmitted through the egg. And anyone who likes their yolks soft boiled is at risk of picking up Salmonella enteritidis, which can cause severe disease in humans. This then becomes a reputational disease for the industry. And so they are very fierce on controlling Salmonella enteritidis. Tuberculosis is a food safety issue, as is bovine spongiform encephalitis, which is also known as BSE, or mad cow disease. I talked a bit about Salmonella enteritidis being a reputational disease, because if people thought eggs weren't safe, they would stop eating them, and so that would cause a serious effect to the industry. And we know that treated properly, eggs are very good nutrition. But this makes it, because this is a human disease and not a disease of animals, it's really tough. So in avian influenza, when we depopulate, we're looking at a barn full of sick birds that are dying, and they may die before we get depopulation finished. It's not so difficult to depopulate them because we're preventing suffering. But Salmonella enteritidis, the birds look perfectly healthy, and they may be producing really well because it doesn't affect the adult birds at all. And so that makes it much more stressful to the producer to say we have to depopulate birds where they can't see a problem. Next slide, please. So in Alberta in 2022, these are the farms that were depopulated. So for avian influenza, we depopulated 60 farms, approximately 1.4 million birds. There was some compensation. So they would be compensated for the value of the birds that were alive when the quarantine was placed. and they would be compensated for the cost of controlling the virus. So burying the birds, composting the litter, whatever method was acceptable. The difficult part of this is all the birds on the same farm are depopulated unless the producer can demonstrate that the two barns have no chance of avian flu moving from one barn to the other. So they have to do things like maybe they have separate staff for the two barns. Maybe they're far enough away that any wind off the exhaust of the infected barn will not get to the other barns. They change clothes, they shower in. Whatever methods they use will be assessed carefully to see if we've stopped the spread of, if there's a really low risk of the disease spreading between the two barns. And the other barn will be tested frequently and hard to make sure that it didn't spread. But in general, all the birds on a premise are depopulated. Again, difficult, right? Because only one barn may be showing illness. Salmonella enteritidis, we usually have a couple farms a year unless there's an outbreak somewhere. In this farm, there were approximately 6,000 birds. There is some insurance coverage. Compensation and insurance coverage never meet all the costs. And part of that is a principle, right? We don't want to make disease profitable. But nothing ever covers the stress of doing extra cleaning, extra depopulation, any of those things. Those are all, there's no compensation for stress. CWD, I gave you some history here. You can see that in 2020, there were several farms depopulated, and it's settled down now. In CWD, depending on the status of your herd, you might get compensation from the federal government, or you might not. If you don't get compensation from the federal government, then the province is in control, and we try and work so you can sell the animals over time. So to minimize losses, but that's an effect. The other thing to remember on all these farms is this is where the people live. At least almost all of our farms, the people live on the farm. So it's not like they're going to an office that has been closed for a flood or is closed today because the heat isn't working. This is where they live. And this is not only their work, it's their place of life. So the whole family is affected, not just the person who's in charge of the barn. Next slide, please. So how do we find a disease? Just excuse me a moment. So discovery of the disease might be through routine sampling, for instance, in the egg industry where barns are sampled twice a year. And so there's a bit of nervousness waiting for the sampling. You might have a suspicion of disease, for instance, in avian influenza, where you have a bunch of birds that are dead when you don't expect them. And that's really nerve-wracking because we all know avian influenza is in the area. And so waiting to find out whether you have the disease is really difficult for farmers. Even a positive result relieves the stress because you now have a direction to go. And then some diseases are detected on inspection. CWD in elk or TB in cattle. We examine the carcasses at slaughter to look for disease. And that's when it's discovered, and then it's traced back to the home farm. And then we look at the rest of the herd. Once we've decided that depopulation is the method, and these are protocols that are written in advance, right? There's research done on it. This is not a decision you make when you arrive at the farm. If it's positive for CWD, you know what the outcome will be. But we have to decide how to depopulate. We have to think about what method will work, what method will be humane for the animals, what method the producers can manage, or the crew that's doing it. You have to gather equipment and materials. If this is not something that you routinely do as part of your production, then this is all takes time and effort, and is out of the norm. So when that's done, that's part of the job, right? The animals are no longer suffering or generating disease organisms. Then you have to do something with the carcasses. You have to dispose of them in a way that the disease can't spread. And it depends a little bit on the disease organism. Composting works for a lot of things. A burial is okay, but you need to have a place that is okay to bury. I'm just going to talk a little bit about some of the methodologies. So depopulation, with poultry, we often use carbon dioxide gas. You seal the barn, you pump in the gas. It's pretty quiet. You hear a little bit of wing fluttering. And when the time is over, then you have to vent the barn. Nobody can go in the barn until the CO2 is dispersed, because that's not safe. And then you go and then you pick up the birds. And you either pile them on a compost pile, like a pile that's been prepared for them in the barn, or you load them in a skid loader, a bucket that takes them out of the barn and either dumps them in a pit or puts them on an outdoor compost pile, or loads them into something else that will take them away. And you can imagine the work that if you have 5,000 birds. If it's TB in cattle and they're old enough, they will actually try and recruit a slaughter plant. And they will be intensely inspected, but everything that is cleared as not having disease will go on through the normal food chain. But the rest will be taken down and disposed of at the slaughter plant, because they have the facilities for doing that. So those are some of the things, and if the producer is able to be involved, it's actually useful, because they're usually the most familiar with the barn and their equipment. They can handle it well. To get a rental skid steer into a barn and then wreck all the feeders that have been raised to the ceiling is another cost and another distress. So it's practically, if the producer can do it, that's a good thing. And then you have to clean and disinfect. Our newer barns are easy to clean and disinfect. It takes a lot of time, it takes a lot of effort, and you're cleaning at a level that you don't usually have to clean at. So it's, and then depending on the disease, it will be tested, it'll be checked. We take swabs and wipe them down and check for dust and see if the disease is left in the barn. But if you have, for instance, in CWD, how do you clean the ground? How do you clean a pasture? For CWD, you can't. And so restocking of elk might be prohibited to prevent another herd from getting positive. With TB, sunlight and time and high temperatures will get rid of TB. But that means you can't use the pasture until your pasture has met that time and those temperature requirements. In summer in southeastern Alberta, that might not take very long. But there's other places now in winter with avian flu. It's all winter because we're not reaching the temperatures that kill avian influenza. Some of the corrals and the buildings are really hard to clean and disinfect. And so then what do? We had one farm that wanted to burn their buildings. It was an old building. They just decided that the most economical way to deal with this old building was to burn it down with the birds inside. And that's effective for disease control. It's very effective for disease control. You can't do that in fire season in November in southern Alberta when the winds are whistling, because there's just no hope of containing that fire on the farm, and you just can't risk the neighbors. So you're stuck waiting till it calms down with birds in the building. And you know what happens to birds when it's not freezing, or carcasses, right? It gets to be really awful. Really hoping that farm that the house was upwind of the barn. Just more stress. And nobody wants that stress. Nobody is deliberately making life miserable. It's just we have to work together to not create a greater risk while we're dealing with what's on our hand. And I already said there may be examples where restocking may be prohibited. There's times where, so for instance, for some of our our breeder birds, so these are the birds that produce the eggs that are then hatched to either be layer hens or to be broiler chicks for meat. They're at the top of the pyramid, right? Those farms supply multiple other farms. And if you take out one of those farms, even the downstream farms then may not be able to get birds when they're clean and ready. And the breeder birds, those deliveries are scheduled 18 months ahead. And if you have to take something out of schedule, you may not be able to get in until your next expected delivery, which might be 4 months down the road. And in general, there is no compensation for that wait time. So those are some of the things that happen on the farm. The other thing we do on the farm, and you can go to the next slide, is we look at where did the disease come from and where did it go to from this farm. So you trace back to where animals came from, and you examine those farms, right? Did the disease start there, or did it start on the farm you found it? Sometimes we can figure that out very easily, that, oh, here's the link. So in birds, we'd look back at the hatchery, we'd look at other farms that got deliveries from the hatchery at the same time. And we might do extra testing at those farms. There might be selective depopulation. So for instance, we have CWD in elk. The elk actually were imported from a different farm. We'll go back to the origin farm, and we might kill all the elk of the same age group and test them for CWD. Yeah, we may look at the records and say, oh, there is actually no risk on the source farm, and not do anything more with the source farm. But we do need to look at the records. We need to look at the animals. We need to make sure that we get all of it. And then downstream, we do the same thing. Did the positive farm send animals anywhere else? So for instance, if we have a breeder farm that sent animals to four other farms, we will examine all those four farms and assess the risk of disease spread. And if necessary, some of those animals or the whole farm will be depopulated. And we try to prevent the disease because these are serious diseases, we really try to keep it localized. We try not to have it spread on the wind. We try not to have it spread on the tires of the school bus. So we create traffic patterns, right? So if you're an infected farm and the disease spreads in the manure, can you deliver feed to your other animals in a way that never crosses the manure track from the infected farm? Can the kids go out to the road to the school bus instead of having the school bus turn around in the yard? you know, can the visitors stop at the house and never drive by the infected farm? So changes to all kinds of things, both on the original farm and the linked farms, to try and make sure that we're not spreading these serious diseases, because nobody wants them. So for my last slide, I wanted to talk about the broader community. So if you're the only farmer in an area with an infectious disease, farmers have told me they won't go for coffee with their friends anymore, because everyone is so worried that you're going to track the disease into the coffee house on your boots, and they're going to take it home on their boots and spread it to their animals and get the disease, and they might be without animals. So it's really isolating. That's really isolating. As horrible as having 60 farms with high path influenza in Alberta is, it means that we have a bunch of people going through the same thing, and they can support each other. And that happened in TB in Southern Alberta in 2016. They were able to there were so many involved. They helped each other. But the initial farmer was devastated, and I hope you get to hear from him, because his immediate thought was, I have a disease in my herd, and I have now involved everyone who has fence line contact with me and everyone who is on the community pasture with me. And so there's an incredible amount of fear, of guilt, of shame. What did I do wrong? I talked about dragging contaminated manure home from the coffee house. We really try and work on biosecurity, right? That you shouldn't be wearing your farm boots to town, to the coffee house, so that you can't track stuff, you know, that you have a town vehicle and a farm vehicle, so that the vehicle you take to town doesn't have manure from the cattle or the chickens. And some of our industries are really good at that, and some of them are not. I'm going to skip to the bottom point. TB in Southern Alberta was a small community. As I said before, the entire family is involved. You might not want to tell your kids what's going on, but your kids know something's wrong. And there was a one-room school in that community, and all the kids that from the affected farm, or most of the kids from the affected farms, went to that single school. Can you imagine being the teacher in that school, dealing with all these kids who know there's something going on at home, and then the kids talk, and then it's not just a farm that's affected. And then up to the middle point, I can't tell you how often I've been on a farm and there's been something else going on. They don't have the heart to work on the barn because their kid just said, I'm not farming with you anymore, and they're trying to figure out what the farm transition is. They're preoccupied because a spouse or a child is in the hospital with medical crisis, and they're trying to, naturally their heart and their soul is in the hospital, and yet they've got all this other stuff to deal with, and so that's often, I'd say that's happening in at least 25% of the farms I deal with. Astonishingly high. Sometimes those two things might be linked, but certainly not always. It just happens to hit, a family gets hit with two things at the same time. And so that was the last of my introduction to depopulation. I am happy to take questions now.
So maybe in the interest of time, we'll go on to Rebecca's, and if anyone has any questions, you can just drop them in the chat and we'll try to catch them at the end, if that works.
That's fine.
Okay, let us go to the next slide. If I can get it to work now. There you go. Take it away, Rebecca.
Okay, thanks, Linda. And thanks, Dolores. So I'm going to switch gears a little bit, and I'm going to describe the research that's been conducted on farmers and vets, and what you're going to hear me say is all going to support and be consistent with what you heard Dolores talk about. So, and I'm going to start this portion of the webinar by sharing some context and a few relevant concepts to help us appreciate and understand the impact that depopulation can have on farmers and vets. And I'm going to start with the human-animal connection. And when I was looking at some of the statistics, Western culture, the number of trends are evident. And according to a Canadian survey that was completed in 2022, over 60% of households have pets, and nearly all of them identify their pets as members of their family. So many studies even document, of course, the stress relieving, health promoting, therapeutic benefits of animals or pets. And that relationship between animals and humans has shifted across time and place. So in some contexts, animals are still viewed as livestock or primary economic, investments, and they're now sometimes viewed as companion animals. So this is particularly true for horses, and is reflected in that changing demographic of horse ownership in Canada and the US, where older horses are kept on farms and more money spent on them to prolong their lives as animals, whereas in other areas, they're still viewed as food sources. Now, with companion animals or pets, that relationship also exists to some extent on a farm. So between farmers and their livestock, it's a relationship that is neither simple or static. And herds of sheep and cattle are not only, for example, a source of income, but are an ongoing part of the lives of farmers and their families. And that emotional connection between humans and animals on the farm that are raised as a commodity has been described as this immensely respectful and devoted, even sacred relationship. Move to the next slide, please. I thought I added this just this morning, and for some personal context here, I grew up on a farm and I worked at a large turkey farm for nearly a decade. And this was a barn. These were turkeys that would lay fertilized eggs, and they would be shipped off elsewhere, sometimes to other countries. And so these are actually some photos from that time I worked there, and this is long before iPhones were there. So these are literal camera, old school pictures. But as you can see, the birds would come in from the hatchery soon after being hatched. And I think in this one, there's about 5,000 poults. And they would spend their time in these barns until they were old enough to be moved down to another barn on the same property for laying their eggs. All of these poults, all these birds were female. They were laying turkeys. And sometimes my job would be to work with the little ones, or it would be to be assigned to a particular barn. And so I would spend a good part of my day with those birds, and they would habituate to you, and you would become familiar with different ones and their distinct personalities. There were some, who would follow you or would chase you and stuff when you're on the floor. And during my time there was one flock that was diagnosed with a condition. It's called Orthinobacterium rhinotracheal, or short form is ORT. And it's an acute condition. It's contagious and affects the respiratory system of chickens and turkeys. And it can be associated with a slightly increased mortality, decreased feed intake, etc. And because one of these barns was infected with ORT, there were two other barns really close in proximity. This was a high stress situation. There was a really strict protocols. Dolores mentioned, how there are different protocols to try to contain, a condition. And so we had to shower in, shower out, and because it was over winter, there was all these extra costs associated with it. And this was a family farm, and this was a huge point of stress for my employers. Not only could they not sell those eggs, but the people who were down the line and receiving those orders had to wait for making an order in the future. Next slide, please. All right, so I'm going to talk about the impact this human-animal connection here. And if we can talk more about the farmers first, if I go to my slides and my notes. So starting with farmers, as I mentioned, farm animals may exist simultaneously as friends and sources of food or a commodity, leading to a blurring of that socially constructed category of livestock or pet. So livestock as these economic machines for converting roughage of meat, milk, and byproducts represents one strand of these relationships. And the sight of, say, farmers being so emotional as they need to undergo, depopulation due to an epidemic is another. And these circumstances, it's a complex portrait of that breach in the relationship one might feel between humans and animals who are in their care. So I'm going to share a study, the findings of a study that was conducted in the UK during the 2001 foot and mouth epidemic. And I chose this study in particular because it moved away from surveys and statistics and focused instead on the lived experience of those affected. So they used qualitative methods. Move to the next slide, please. Okay. All right. Okay, so now the impact of, let me just move here. All right, Linda, can you move to the next slide, please? Perfect. Okay. All right, so this study was conducted by Convery and colleagues, and for their study, they wanted to understand how farmers and others in the community, how the relationship between the land, the livestock, and the farming community changed as a result of this disease. And they didn't use just interviews, they also included diaries. So participants in their study had diaries that were later collected by the researchers to help illustrate how their lives had been impacted and disrupted by this foot and mouth crisis. And it would be, of course, disingenuous to argue that everything was, on the farm was rosy before foot and mouth disease. As many participants identified, working on the farm comes with a lot of ongoing stressors. And they drew a lot of identity, self-esteem, and well-being from their day-to-day environment. And so for many, such everyday places change dramatically in the event of foot and mouth disease. So I wanted to share some quotes from participants, and this is an actual aerial photo from one of the farms impacted to get you a sense of the scale of this. And of course, the 2001 foot and mouth disease had a huge impact on not just the agricultural community, but also tourism and the greater farming community. So as noted by one farmer, the quote at the top, they felt this enormous amount of shame that their farm had been impacted. For a group of individuals, for example, who value privacy and stoicism, their misfortune was kind of out there for all to see. And for many, the calls brought a sense of failure, a loss of professionalism, and a sense of not having done the job well. And common in farming is a sense of good stockmanship, whereby there is great pride and satisfaction in relating to the process of rearing a healthy stock. So further highlighting the fact that these events happened on public display is a quote from a school teacher. So even though they were not personally impacted, they might have to drive past this area every day on their way to work, and they witnessed the effects on others. And they recalled the smell and the stench of those farms. And these familiar places that it took on a new meaning for them after foot and mouth disease, and they were never viewed the same way again after that crisis. And for some, the scale of the calling impacted their sense of identity of everyday living. For example, the outbreak of foot and mouth disease in the midst of, say, lambing season was meant that many farmers who had maybe anticipated this period of seeing their flock spring to life instead had to put them down. So it's a clear breach of normal relations. While lambs might be normally slaughtered, it doesn't happen, say, with newborns, and the rhythm and cycle of this livestock farming relations was really out of sync. For others who are even more proximal to the crisis, like small business owners, and there's a quote at the bottom for one of them, they recognize that this having to depopulate a herd, in this case it was a cattle farm, meant that there was generations of building this pedigree was just completely lost. Next slide, please. Okay, so I decided to include this image from the article because it describes one person's experience here. And it's the individual, her pseudonym here, we'll call her Carol. It really shows the multidimensional impact that this experience had on her. And this is considering her life space, if you will, or the impact that depopulation had on her life. And it really is multidimensional. So she was a farm wife who worked off the farm. And she describes, that immediate effects and residual fallout of foot and mouth disease and how it impacted her life from her relationships with immediate and extended family. Her children at different times experienced disturbed sleep and nightmares, and her own health deteriorated. And then she describes issues of trust and mistrust with the government and her own difficulties with community identity. And the family flock that was called, within these farm buildings. And she described this family trauma and how it was on public view, and how when the animals were burned, it was close to the road, creating this kind of plume of smoke. So what was significant, though, was how that everyday experience of being on the farm, really a central focus of her own identity and way of life, became associated with death. And for Carol, those everyday places now took on a new threatening meaning that she had to somehow navigate through. Next slide, please. I'm going to talk now about the impact on veterinarians. And again, this is going to be really consistent with what Dolores said. And I'm going to use now, while there's been more research in the past 5 years on this, I'm going to continue that discussion on foot and mouth disease because it was probably one of the most intensely studied and one of the first well-studied impact on vets. And what do we learn from that? So to help with the depopulation, there were vets that came overseas to help with that process. And those vets would usually do a 30-day tour. And during that time, I essentially learned a lot. So during the most intense periods of new case discovery and depopulation, some vets were involved in depopulation for many days in succession. And then so in addition to dealing with the euthanasia and disposal, the vets were maybe the principal contact for farmers, and support for farmers. And a lot of these roles took on additional stressors that they weren't prepared to in a very emotionally charged environment. And the vets interviewed found that they themselves wanted to talk to someone who was familiar with their situation. So someone who either had a background in farming, farmers themselves wanted to either talk with them, or again, someone who was really familiar with agriculture, because they felt they were able to relate to them rather than talking to community caseworkers or government staff. What happened after the tours? What they found was that vets and technicians, they were debriefed before returning to the States, but a lot of this debriefing consisted of maybe introductions to facilitators or written material on post-traumatic stress. Some of the main stressors was about training protocols, not feeling prepared for what they were kind of walking into, maybe having insufficient interpersonal skills, like how do I navigate these, these discussions with farmers who are so emotionally, distraught, and not just the farmers, but the farm family. Next slide, please. So a lot of the farmers did express symptoms of post-traumatic stress disorder. So I wanted to just talk about, the responsibility of euthanizing animals under any circumstance can create moral stress. And for vets, it's often called this caring, killing paradox, as vets struggle to maybe balance their love for animals with the necessity to euthanize them, right? It's not why they entered the field, right, or their profession. So studies of those who work involving euthanizing animals have found that those individuals suffer from a form of post-traumatic stress disorder, but it's not called post-traumatic stress disorder. The preferred term is called participation-induced traumatic stress, or for short, PITS. And PITS is different from PTSD in that PTSD follows life-threatening or a terrifying experience, whereas PITS does not involve a direct threat to the individual per se, but instead it may threaten their ethical character. So their identity as a vet who cares for animals yet must implement euthanasia. This phenomenon is often studied more commonly among shelter animal caretakers. So we're exploring it with our current research I'll discuss in a moment. But the degree to which PITS is amplified tends to happen when there is a bond between, say, the farmer and the vet, like the vet is familiar with the farmer and their herd or flock. When there is obvious sickness, the vets usually experience less distress if the animals appear to be ill than when they appear to be healthy. And then the third is when there are the sheer number. So if there are many animals that need to be euthanized, that's more distressing. Next slide, please. Okay, so this is my last research component slide I'll discuss, and it's a study that was conducted by Basinger and Corgan that's fairly recent, and they studied swine veterinarians and how they dealt with mass depopulation during COVID. And they distributed a survey to vets across the US who were active in that time, and they got 134 surveys back. So what were their main findings? They found that depopulation distress really involved two components. It was the ethics of care, so that's the participation in killing the animals, the idea of depopulating healthy animals, making decisions about whether or not to depopulate, and choosing the right method. And then the second component was the perception of others. So, how does the public and their colleagues and the family and neighbors feel about this? The extent of public criticism of, the depopulation methods. So these two components really weighed on their mind. Vets experienced a high rate of burnout, and burnout, of course, there are three components. It's that emotional exhaustion, depersonalization, and a reduced sense of personal accomplishment. 10% of their sample expressed thoughts of or suicide ideation within the past 12 months. And when asked, had they thought about seeking help, well, they recognized their own mental health struggles. Less than 20% said that they recognized that they needed help, but they did not seek it. And when asked, well, why didn't you seek help? It was mostly that they didn't want to take time off work, or it's expensive, or they couldn't find someone who maybe had a good fit for understanding their own unique needs. Next slide, please. So from this study and from others like it, there was a call to action to enhance the availability and visibility of existing mental health services and taking the necessary steps to destigmatize mental health. So at AgKnow, these are some of the issues that kind of influence and impact and inform our work. And depopulation, it was one of the topics that came through very strongly when we conducted our needs assessment last year. So in response, one of our first studies, it's active right now, it's investigating the experience of depopulation among farmers and vets. And then the other studies that are either active or forthcoming is delivering mental health and support services in rural communities. So this is from the experience of the community service or mental health worker. How do you provide? How do they change their services and provide support? We're also right now conducting a farmer stress and coping survey to more precisely understand what are the levels of anxiety, stress, burnout among farmers, so we can give that report on that information, give it back to our referral network and our community. And then we'll be looking at farm transition, another area of stress among farmers. Next slide, please. Okay, so maybe I'll turn it over to Linda now.
Yeah, thank you all for participating. Please do give us some feedback. Feel free to reach out to us. You can reach me through with my email here, or Rebecca through the research at agknow.ca. We have a standardized form for you guys to fill out that'll be emailed to you that you can fill out and let us know how we did with this webinar. And I do apologize for the messy links and getting everybody started up at the beginning. I kind of really relied on my staff and they're not here anymore. So it's me trying to figure it out. So that is totally my fault and I do apologize and we'll do better next time. So if there's any other questions that you have for Dolores, we have a couple of minutes left on our time here, or questions for Rebecca, and nothing came in through the chat. I don't think. That's about it. So with that, I
Great
guess.
presentation, guys. As somebody who's been touched peripherally by that, I had neighboring farms twice in my life lose herds, and having chickens, I like biosecurity is my life, you know, like they're just my own little flock. And I grew up around a chicken farm. I can't imagine losing an industrial flock. Like, I think it would be crushing. And I agree. I had my horses well into their mid-30s. So I get it, but it was a wonderful, wonderful presentation. Don't worry about the blips at the beginning, Linda. We all have them. And Dr. Peters, are you related to Dr. Peters of the dental faculty at U of A? Dr. Ed Peters.
Don't know.
Okay,
Don't know.
just
There
thoughts,
is,
maybe. But thank you very much.
I had a great uncle called Rudy Peters who was a dentist, and I've lost track of that family, so maybe.
Okay, well, call me because he taught me and now I teach there too. So I'll hook you back up with that family. I have to go, but it was really wonderful. I appreciate so much because I think it's such an underserved area.
And I just want to say, some farmers practice really great biosecurity and shit still happens.
Right? It's nobody's fault.
Yeah. Yeah.
Yeah. And I don't think people realize how traumatizing it is. So it was really like heartbreaking to hear because it's so close to my heart, but I think you did a great job of presenting both sides of it.
Awesome.
Thank you.
Well,
Thanks, guys. I
everybody.
got to run, but thanks again.
See ya. Thanks, Laura. There we go.
I see Susan, go ahead. I see your hand up.
Oh, did I miss one? Hi,
Not at
Susan.
all. Hi, Linda. So nice to see you again, and nice to actually virtually meet Rebecca.